Thanks, Jose. Thank you for being here and doing this interview with us. Jose is one of the clinical psychologists at Bossa Health. And the reason we wanted to have this conversation with you, Jose, really is because we toss the names therapy, psychology, psychiatry everywhere, but we don't necessarily understand what it is. I've seen so many people use it interchangeably, or asking me even what is the difference between psychology, psychiatry, and so on. And I guess that's kind of what I wanted to get from this, to learn more from you and understand how you as a psychologist can support patients with Bossa Health, or anyone else really. So
Okay.
I guess, to get started, tell us a bit more about your background, how you got to the point where you became a clinical psychologist and the focus of your work.
Excellent. Nice to be here, Jasmine. Thank you for inviting me. So I joined psychology randomly. I didn't plan to study psychology. So I just like put psychology as one of my possible options, and they took me. And then after year one, I realized that I was in the right place. And in my second year, I started having clinical psychology subjects. And then quickly, I also realized the area of the psychology that I like is going to be clinical psychology. And since then, I did all the optional clinical psychology subjects. And also I did my practicum in clinical psychology. And then I did my master's in clinical psychology and health. So I became a clinical psychologist officially in 2005. So it's my 20th anniversary this year. It was in July this year. And yeah, a little bit random, but soon in year two, I realized, yes, I want to be a clinical psychologist.
And Jose, and what would be the difference then between being a counseling psychologist versus a clinical psychologist?
So you have psychology is like the profession, like the science, like for example, could be like medicine or could be like psychiatry. And then within the big umbrella psychology, then you have like different areas. And then you're going to have like clinical psychologists, educational psychologists, counseling psychologists, neuropsychologists, etc., etc., etc. I will say that, for example, one of the things that is specific for clinical psychology is we are the area within the psychology that deal with the mental health disorders. So, for example, we work closely with psychiatrists, and then we are able to do diagnosis, therapy, and many other things. But clinical psychology is strictly, like linked to mental health disorders, and then the following intervention for those.
Makes sense. And what kind of challenges do people bring to you? What's your expertise in terms of the different conditions that you can treat?
Yeah. So for example, I started my career working with adults, and then also like, elderly, some cases of elderly people. And then again, randomly, when I moved to the UK, I just got a job in CAMS, and then I started working with children and adolescents. So the things that I commonly work with is, like behavior problems, ASD, ADHD, learning disabilities, and then overall mental health. I would say like nowadays you have like depression, anxiety, PTSD, talk, OCD. I say talk is in Spanish, OCD is in English. I would say those are the big ones, like low mood or depression, anxiety, and then we start seeing a lot of like PTSD, and then like OCD, some behavior difficulties, and stress. Stress is probably, if not number one, at the top three of difficulties that I encounter in my daily practice.
You touched on a point that's very interesting, Jose. There are different levels of severity of conditions, right? You have conditions that are more mild, perhaps they need short-term intervention. Some require more longer term. Where would you place that sort of, what does it look like? Do you see more people that have, that require long-term support? You mentioned stress. Is stress something that we misunderstand in daily conversation. It actually requires more intensive intervention than we might even imagine.
Yeah, it depends, Jasmine. That's a really good question. Like, for example, within psychology or clinical psychology, we have like different interventions that, for example, they are already number of sessions. So, for example, you can, there is a program, for example, for treating like low mood or anxiety with children, and they are, let's say, for example, 8 sessions, and then you start, session 1, giving some information, and then you're moving on, and at the end, you give some strategies and a follow-up. So there are some like therapies that they are number, but then cases, they are all different. So, like you might have somebody that is really struggling with anxiety, and if that person takes therapy serious, they could improve in, I don't know, 2, 3, 4 sessions. Or another good example, I work a lot with families, and the children, they have like behavior problems. And if you speak with the family, they might tell you that it's really bad. My child is misbehaving. He can be aggressive, or she can be aggressive. She's really strong. But then when you work with the family, and then you convince the family to trust you and to follow the therapy, you can get, improvement in a couple of sessions, for example. But then the other side of the coin is like, for example, you get cases that when you read the referral, they look mild, but then when you start working with that case, you realize it's not that easy. It might be more complex. Another thing we have to consider is the context, the environment. Me working with children in the last 10 years or a little bit more of my career, it's funny because usually we get, I have a problem with my child. My son is misbehaving. My daughter is having problems at school. And then you realize it's a group difficulty. It's never just the child having difficulties. When you deep, a little bit, then you realize the dynamics within the family, the relationship, the interactions, and then you have to, work with the whole family. That's what I like to do nowadays. And the same thing with adults, like the difference is like when you work with children, most of the time, you have access to the family and you can work with them. With adults, it's different because, they are over 18. They can say to you, no, I just want me working with you. But if you could have access to the family, it will be, really nice.
No, that's amazing, Jose. And it's that holistic approach in a way, isn't it? Covering different aspects of that person's life. And I think one of the things also that you touched on when it comes to working with adults. So it's common that people start out therapy and, seeing a psychologist and a psychiatrist with some level of resistance, especially when it comes to people being diagnosed. Some people don't want to, there's so much stigma, around so many different conditions that people don't want necessarily a particular quote unquote label, right? So how do you address that? When somebody comes to you, how can you find that balance between, okay, this person requires a formal diagnosis versus let's treat it without adding a label to it?
Yeah. So again, you have to adjust and adapt to the family or to the client always. I think yes, there is resistance, but it depends where you get the cases from. So for example, if somebody pays for that, usually you don't get much resistance because they want to go, they have to pay for it, so they're willing to. Then for example, free services, sometimes like for example the NHS, you might get families where they don't want to be there, and they are there because the school made a referral or the GP made a referral, but they don't believe there is a serious problem, so you might have some resistance. Or for example, when you tell family or the client, whoever, you suggest some changes, sometimes they don't want to change. So that's where you will see the resistance there, or lack of understanding, or what you say, some people, because of the stigma, they just don't want to have a diagnosis, or they not ready to admit that they have a difficulty. It doesn't have to be a diagnosis all the time. It can be just, a difficulty. In England, for example, in the UK, we work a lot with like a formulation. And a formulation, you don't need to have a diagnosis. You can formulate the case with all the information that you have, all the variables, and then you can start working with the client and the family or whoever. So diagnosis is good if you can have it, in my opinion, but it's not strictly necessary to work with somebody and to move on. So some people, they're not ready for the bad news, or they're not ready for the change, or it's just difficult for the time being, and that's where you see the resistance. But honestly, I think when we do our job professionally and people see the changes, I think they just drop their hands down and they go with you, they trust you, and usually we see improvements. I always say everything can be improved. Some problems are really deep and complex, and it might take, years, but you always can improve something. And if you manage to improve a little bit, overall, you're feeling better. And this little change here might affect another one here and another one here, and you might start the process of healing and getting better.
Oh, that's amazing, Jose. And that actually leads into one of the questions that I wanted to ask. And this is a very generic, broad question. So maybe there's no specific answer. But if you had to, you mentioned the changes, right? How people can start with a little change and go from there. So what are some of obviously every condition has its own challenges, but what would you say is that main change? Is it self-acceptance? Is it putting techniques into practice? What would you say is that big change that you see with your clients?
I think realizing and accepting there is a difficulty, and also like knowing or seeing that getting better is a real option here. So I would say like realizing and accepting is going to be like number one. And then number two will be like believe and trust the process. Like sometimes we have to convince people a lot of, and I get it, I completely get it, because sometimes like you might give an advice and they will go, oh, I don't think that will be a good idea, or I don't know if I can do that. And I always say, try, try. And if it doesn't work, like next session, we can talk about it, and then we will introduce adjustments. There is nothing like 100% exact here, like there is no like something that is going to work 100% of the cases or 100% of the time. So we can adjust it. It's mobile. But yeah, when you accept that there is a difficulty and when you trust the process, and also really important, Jasmine, the rapport with the clinician, if you don't have that connection with your therapist, it's just very difficult. It's very difficult to trust, to engage correctly, or like to remember what we agree in the last session, for example, or the homework sometimes we give them. If you don't connect, very difficult.
No, that makes sense. What would you say, Jose, is what do you think people need to understand about therapy and psychology before getting started? Not that necessarily means having more knowledge will ensure that there's no misgivings or that will make the fear go away completely, but knowledge a lot of the times is a powerful tool, right? It makes you less scared. It makes you more prepared to face it head on. So what do you think people need to learn about psychology and therapy to feel more encouraged to get started and to seek help?
Listen, very, very simply, I would say, we have health, all of us. There is like this word, this concept called health. And then health, you have physical health and mental health. So the same way is completely normalized most of the times when you have something in your body, that you will go to the GP or you will go to the specialist and you get an appointment, you want to know what's going on, and they will let you know what it is, and then you will get some treatment or you will listen to the doctor. That applies exactly the same for mental health. But because of the stigma and, people believing, oh, those are crazy people and, they are like very odd. So we carry on all that background and we're still trying to catch up. But it will be the same, when you realize that you are, feeling low, or do you have been nervous for a while, or something is like, in your head bothering, or you are having problems with your partner, or you are having problems at work, and it's nothing physical, but sometimes like they are interlinked, physical health, physical, not always, like most of the time I would say they interlink, but usually people, they will go and try to find a physical explanation, and then they go there, everything is okay. Oh, so it's mental. So then that's the barrier there. Some people will happily go, and I've seen that change more and more, where people go to psychologists normal, they talk about going to therapy, they discuss about the therapist, they say how, my child is struggling at school, can you help me to get better, can I get a referral to camps, etc. So I see that change. But to explain to people is like, just think about health. You have like physical health and you have mental health. The same way you trust the doctors, the GPs, the specialists, trust the mental health clinicians as well. Go there. If you have to speak with a psychiatrist, go. If you have to speak with a clinical psychologist, go. For example, children at school, educational psychologists. But yeah, just like believe in the profession the same way you believe and trust a normal physical health doctor.
Absolutely. And I think on top of that too, and it's funny because this month is Men's Mental Health Awareness Month.
Yeah.
And that's a big one, isn't it, Jose? Obviously we know that, across the board people face challenges with stigma and discrimination. But what is your experience with men and mental health? Do you see a lot of men coming to you? Is it harder for men? What is your experience with men and mental health?
Yeah, I've had always more women cases than men cases, and I still think that men overall, they struggle to talk about like their difficulties, their mental health struggles, and I think it's something that goes with the differences between men and women. Like women, they have like more facility to talk about emotions, they can connect like easier with others. I think like they are in touch with their feelings and emotions more than we are. And that's not criticism, like that's not saying the typical stereotype, oh, women are more emotional. No, it's just like saying they have like more facility to do it. And I think like they ask for help earlier than men. I think like coming from the traditional stereotype, like, oh, the man has to be strong and he needs to provide and he needs to care about the family. So it's like, men can cry and they have to be tough. So we're coming from that, and I think like sometimes like men, they might feel like they are weak if they are struggling mentally, and that weakness might be like, oh, I don't want to accept that, so I'm going to put like a barrier here and I will try to deal with it by myself. And it's just not right, like I think like in that sense we all the same, like we all have difficulties, we all have struggles, and we all have the right to ask for help regardless what you are, men, women, whatever. So for example, if you work with little children, you don't see this. You don't see this. You see like the little girl and the little boy, they will tell you openly about, whatever you ask them. But then as soon as you're growing up is where society comes in, and society rules and stereotypes and, your family belief about what it means to be a woman or a man. And that's where you are like, constructing your personality and your like views of life. And that's where the problem hits. If you talk to them like when they're little, no problem. They happily will tell you whatever, and they will happily open up about whatever. But as soon as they grow up, that's when we're having like more difficulties.
No, absolutely. What would you say, Jose? One of my final questions for you. What would you say to anyone watching this, particularly men who are like, no, there's absolutely no way I'm ever going to seek help, but no, absolutely not. What would you say to people that are questioning whether or not they should seek support?
Give it a try. Just give it a try. And if you don't like it, don't go again. But just give it a try. put aside your beliefs about what therapy is, and just give it a try. We have services in the UK. You have like obviously the NHS. There is a waiting list, but we have services. We have private services, like for example, us, Bossa, and many others. Just give it a try. But I also will say, give it a try, but give it your best. Go there believing, all right, I'm going to come and speak with this professional, and I'm going to listen. I'm going to try to do what they ask me to do. If you're going to go there to challenge what the professional, you can challenge the professional. I can give you a quick example. 2 days ago, I was working with with a client, first session, and then she said to me, I really don't believe in psychologists because my brother, he has schizophrenia since he's young. And then I never saw or I never felt that the psychologist did well with him. And she told me that, and I said to her, thank you for telling me. This is really important. Now I know why you might not feel okay, with psychologists in general. Let's talk about it, And I thanked her, and I didn't take it in a bad way or as a criticism. It's her experience. I have to believe her. I have to validate that. And then hopefully being professional and working really hard with this client, she might change her view. And maybe by the time we finish, she might say, you know what? Psychologist, he helped me. So now I have like a different view, and I might even recommend people to go to a psychologist. So, always like, people, be honest. If you don't like psychologists, why is that? Let us know. Tell us. And another thing, like lately, I always say to people, listen, ask around. Like if you're looking for a professional, ask around. Maybe, I think like most of the private practices, we always offer like a 15 minutes free video call. Maybe book a few, book maybe one with me, one with the other guy, one with a lady. Book 4 and then make your choice. Like it's not like, oh, I just look for one and that's the guy. No, the same way like you can go to a normal doctor and you can get a second opinion, you can do that. And then you might go and book an appointment with a physiotherapist and you don't like it, and then you can move to another. The same thing with us, like you can ask, what is your background? What are you exactly? Are you a psychologist? Are you a clinical psychologist? What is it? Do you do like therapy? You don't? What is counseling? Ask the questions. That's what we're here for, to clarify the profession. And also, I think like being professional is like, if you don't have experience or you don't have the knowledge to help somebody, and I think like pretty quickly you can say that when you're working with somebody, Jasmine, when we do an initial assessment, I can tell you by the end of it if I can help you or not. If I have the experience, the training, and the knowledge, we can go ahead. And if no, I will say to you, you know what? Thank you for, sharing, everything today with me. I can't help you, but I'm going to help you to find the right professional, or I'm going to guide you or point you in the right direction. That's just like, like mental health is massive. It will be like asking a doctor to know about everything about medicine, and to be honest, it's like, no, that's why we have like a specialist. So yeah, I would say to people, just give it a go, try. But if you don't like it, then stop going, but just give it a go. We're good people.
I love that. My final question for you, Jose, is something that I've heard a lot of people comment on or wonder.
Yeah.
For example, we do online therapy and online support. What do you need to adapt to be able to deliver a session online to the same level of quality or personalization, or that you would in a face-to-face session?
Yeah. So everything is the same. Like the same way you deliver face-to-face therapy is the same way you deliver online therapy. Obviously, like the energy, the rapport, the connection with the person, if you are face to face, is better, bigger, for the good or for the bad. But yeah, that's true. That's the reality. But efficiency, I would say, is like very similar. For example, telephone therapy, like accessing therapy by phone, by a phone call, that is like super old. That is like, I don't know, 20 years ago or even 30 years ago, that existed. Like you could speak on the phone with a professional. So if that was a thing 20, I don't know exactly when, Jasmine, but I don't know, 20, 30, 40 years ago, and it's still a thing nowadays on the phone, a video call is way better. You can see that person, you can see the faces, you can see the expressions, you can check the body language. So in my opinion, video calls are way better than phone calls. But phone calls can be also like effective. And then at the end, you have, like the traditional face to face. I think COVID changed everything. Like for example, in camps or schools, we always work face to face. I always work face to face. I only did like phone calls, no video calls, phone calls, just to check in. How is it going? Is it all good? Remember, I'm seeing you next Thursday, whatever. But COVID changed all of that, and we all have to adapt to that, to the new way of delivering therapy. And then the benefits: you don't have to go to the place. You don't have to commute. You're not gonna waste whatever time it takes you to get there and then come back. No, you can be at home comfortable. So like times efficiency is better. And then again, most of the time it works as well as face to face. But I have to be honest, like the connection, the energy, even the proximity with people is obviously way better face to face. But online therapy is is almost as good as face to face.
Perfect. And you're right. And also, like, as long as the therapist and the psychologist and the psychiatrist have the the expertise and the experience doing it, it's a very different. If it's somebody that is doing their first session online, okay, that's a different story. But
Yeah.
you're right. We've been doing it for so long now, since COVID. It's been like 5 years now that
Yeah.
people are a lot more used to it.
Yeah. And also, sometimes can be, in the clinic, the context and the environment is like very controlled. You have your, but also again, like maybe we have to think a little bit about, for example, the traditional clinic setting. It like, sometimes can be like very flat. You have like an empty room with two chairs, or might be a table there, and that's it. When you work with children, it's more like like children. You might have like toys or like drawings, more color, yeah, to cheer them up. But with adults, I've worked in places where the setting wasn't good, to be honest with you. And if you were feeling low and then you walk into maybe that clinic, you might not feel happier because you were, oh wow, this is really sad, this place. And so what I was going to say, like sometimes in online therapy, we always say to the people, listen, you need to find a quiet place. If you are home, maybe like in your room or somewhere. But we encounter really funny things. Like sometimes, like you're talking to somebody and a child is running in the back, or somebody knocked the door, or somebody just walk in, or whatever it is, Jasmine. Is it ideal? No, but it's real. That's real life, and we have to be able to adapt to it. And still, you might take a mini break and you say, listen, deal with it, and then I'll wait here. But yeah, I have seen like really funny things, since COVID, especially. I can tell you just a quick one because I think it's really funny. So working with this family, yeah, like the couple and the girl. And then the girl, she didn't want to come to the sessions. She didn't want to come to the session. She was like, she didn't like to hear what I had to say. So I told the parents, you stay there in the coach, yeah, and then let her. And I remember they were talking to me, and she ran off to the door, screaming, I don't want to be here, hang up. And I said, like, hold on, guys, let's keep talking, yeah? And then you see the little girl like coming to the camera, bam, and then walking away, and then you see her again coming in, and then by the end of the session, she sat for a little bit, but then the session after and the session after, at the end, she joined. But it was funny, like see her running, shouting, "I don't like this." But then when you know what you're doing, and then you say to parents, hold on, don't chase her, don't run after her, don't force her to say, I can work with you guys without her or without him. Yeah. So let's carry on working. Let's not make it about her or him. Let's keep working with me. And then usually they, end up joining. But in the meantime, it can be really funny and challenging.
No, absolutely. I think, to be honest, I obviously did therapy as well. And it's very interesting, Jose, because I think you touched exactly on what I personally feel is the most important thing that I learned, from therapy, which is patience, and you touched on this earlier too. Things are not going to change from one day to the next.
No.
They won't.
No.
Especially if you're an adult. It's years and years of you behaving in a particular way, using certain strategies. So changing is really, really hard. But you're right. I think being patient with the process, yes, it might take a year before you can see changes. It might take 2 months, but it's the consistency of like showing up for yourself really is what gets you there.
And Jasmine, one last thing. Another advice to people: seek help at the beginning. When you're not feeling okay, just go for it. Don't wait and wait and wait and wait, because the job we do, it will be way easier and faster to achieve change if people would come to us earlier. And again, how do we explain this? The same thing. If you have a mole in your face and you go to the dermatologist, as soon as you got it, it's going to be better than if you wait and it's growing and growing and growing, and then at the end it's like really bad, So the same analogy, like when you realize something is off, and go with your gut feeling. Your gut feeling is going to tell you something is off, something is going on, and then seek the help. And if that happens, sometimes we are very effective, like at the beginning of the issues, of the problems, we can give you some advice and we can stop the difficulty quickly. But it has to be, at the beginning. If not, if you wait, again, what you just said, like years and years and years of discomfort, then it's going to take some time to get better. But it's possible.
Absolutely. I love that. I love that message. Thank you so much, Jose. Thank you for your time. Thank you for doing this. I think I've learned so much, and I'm sure a lot of people will learn from this as well. So thank you for your time.
More than happy to be here, Jasmine, and thank you for this time.
Absolutely.